Okay, what I would like to do now is to use this program to check my results about ossicular reconstruction, about ossiculoplasty. So I came back to the same starter with the selection of chronic otitis surgery without cholesteatoma. So again, we have these 4,000 cases plus. And so if you look to the tab, again, in the same way you have on the left the material method with the number of cases, etc. And on the right, the pre-op hearing thresholds with the 4 frequencies which are already selected to calculate for calculation, and the different tabs here. First one is stage. You remember I explained that primary, revision, and second stage. Clinical, you can select each line separately. Specifically, for example, if we go to the clinical things, we can check about the otoscopy, if we have or if we don't have tympanosclerosis or tympanic membrane perforation, etc. Each line, as you remember, would be completely separately, could be studied separately. If I click on the tab number 3, which is related to surgical points, surgical items, then we have the different type of procedure that was used in my series, but also what I call associated pathologies, which means the status of the ossicular chain, like for example dislocated malleus, retracted malleus, tympanic membrane lateralization, short incus or eroded incus, like this, eroded dislocated incus or eroded malleus, tympanosclerotic stapes fixation. That would be an interesting, of course, item. And as you remember, if I click on one line, the program will select only this line. So if I want to study my result in case of tympanosclerosis stapes fixation, I will click on this line and the program will select only these 433 cases. Would be also interesting to inside this tab surgery to study the type of surgical technique which was used for the ossicular chain. So it could be ossiculoplasty, of course. You see we have 2,722 cases of ossiculoplasty here, and the associated surgical technique now, malleus relocations, elastic bending, etc. And the same thing with the tab ossiculoplasty. We can definitely study what we have done according to the different type of surgical presentation, Austin Cartouche group. I explained to you that I'm using this classification, which is a specific one, but if you prefer another one, you can enter the new one inside the program. And of course, the different type of prosthesis which I use, I will show you also in the program how to enter at any time a new type of prosthesis which was not already listed in this series. Okay, so let's go back now to the type of prosthesis which was used, and let's say that I want to study my results when I was using a PORP or when I was using a TORP. So if I go to ossiculoplasty, let's go first. I'm going to select stage, and this I will select primary surgery. This is better, so we'll reduce the number. And then I go to, so we have 1,937 cases. Then I click to ossiculoplasty here, or I can go first to surgery, and then surgery. I will click on surgical technique, for example, like in this one, ossicular chain surgical technique, ossiculoplasty, 984 cases within this tab of with selected case of primary surgery. So I will click to this line, and then the program is going to select now 984 cases with ossicular reconstruction, whatever I did, of course. So again, we have the date, the beginning of the first prosthesis which I used, and the last one in June 2020, minimum age and maximum age, and on the right again the pre-op air-bone gap and bone conduction and air conduction. Now, interesting would be also to see what type of pathology was identified during surgery. So we go to associated pathology, so we can describe how many eroded dislocated incus we have, 620, or many eroded malleus, etc. So let's say I want to study specifically my results in case of eroded, dislocated incus. I just want to forget the other one. So I click to this line, 620 cases, and I have 620 cases. There are other type of surgery which were associated, like fracture of the malleus and the dislocated malleus, etc. I want to remove all these things because I just want to be sure that I'm going to specifically select only eroded, dislocated incus. So I can go to Ossiculoplasty, and then I go to Group A, Austin Cartouche Group A, that's tab Ossiculoplasty. So in that case, of course, I will have to select only 439 cases. So by the way, I want now to determine what are my results in case of absence of incus, presence of malleus and stapes, which is Austin Cartouche Group A, and when I was using a PORP. So you can see if I go to see type of prosthesis, we have different type of prosthesis. This is a TORP, this is a TORP, this is a total piston, this is a PORP, so this one will be selected. This one is a TORP, this one is another PORP, etc. So let's say I want to study only my PORP, but I have different types of PORPs, so I will remove the TORP. This is a TORP, so I remove this one. So I click to this button, remove, and I click to this one, so I remove these cases. I want to remove also this TORP. I want to remove this total Teflon piston. Then I want to remove this TORP again, and again this TORP, and again finally the autographed partial. So we have three types of PORPs. Maximum was 144. This is the COS HA Flex PORP. That's a quartz titanium PORP, and the specific one, hydroxylapatite titanium PORP. But let's say I want to study all of them. That's interesting. So now I click to with pre and post-op audio like this, 144 cases, and then of course the program immediately is giving the post-op results. Like on the right we have all the post-op air bone gap within 10 dB, and also the mean and pre and post-op air bone gap, as I explained before, the mean pre and post-op bone conduction and air conduction, etc. We already seen that before. And on the left we also have this sex ratio, the mean age, beginning of this study, 1992 and 20, and minimum age 5-year-old, maximum 95, and the follow-up minimum 3, 2.6, up to more than 200, like 286.2 months. So everything you need for a complete publication is there. And of course, you can then export that and you can store that on Excel format as I explained to you. I will make, again, as I told you, a specific demonstration for that. Now, let's go doing the same thing in the same group of Austin Cartouche Group A, in case of eroded dislocated incus, with Ossiculoplasty, in case of Austin Cartouche Group A, the use of TORPs now, because of course I want to compare my results, so I go back to surgery results, then to biopathology, CSOM without cholesteatoma. And of course I have to follow the same path as when I was following before, when I was studying the PORP. So I will click on first primary surgery, then I have to go to surgery, and then I will go to associated pathology, and I have to select eroded dislocated incus, this one, this one, and of course I have to go to surgical technique. That's the one. So I click to Ossiculoplasty 620, and then I go to Ossiculoplasty tab, and then I will select Austin Cartouche Group A, this one. There we go. So now within this group I want to study only now my results in case of using TORP. So I have to remove all the PORPs. Remember, so I click to remove first, and then I'm going to remove this one because this is specific, total Teflon piston. I don't want to start to put that into my group of study. So I remove now COS HA Flex PORP. Now I click again to remove. I want to remove this one, COS titanium PORP. And then I also want to remove finally autograph partial. And then we have 290 cases of TORP. Sorry, this one I need to remove this one. I forgot this 10. So I remove this Vincent HA titanium PORP. So we have now 280 cases, which I need to compare to the previous one, in case of Austin cartouche group A, with all these stops. So we have all the things here. We have primary surgery, eroded dislocated incus, Ossiculoplasty group A, malice in stapes present. That's it, and these are only the TORP. So in that case, now I think I can click to with pre and post-op audios. So doing the same, 257 available post-operative available data. So again, we have the same thing here. The follow-up, mean follow-up, maximum and minimum, and also the airborne gap, the post-op airborne gap, the mean pre and post-op airborne gap, and same thing with the bone conduction and air conduction. And then I can export that in the same way of comparing my result between PORPs and TORPs.